Growing up with sickle cell as a kid, I had to deal with things that I feel like a kid should never have to deal with, especially at such a young age. Dealt with something called sickle cell crises, which are pain episodes that can last from days to weeks to, unfortunately, months sometimes if you have a perfect storm of triggers hitting you back-to-back, sickle cell pain triggers.
So it starts with an idea, and my idea was I need to make a game for kids with sickle cell anemia.
It might not be obvious how sickle cell ties into cleaning chaos, but there's actually this idea of returning to daily activities such as cleaning your room, but at the same time, stress relief is a huge deal.
Sickle Hero follows in those footsteps of getting kids to be active and move to the music. In my game alone, you're able to go inside of the body and see what is happening with these kids, and that's impossible otherwise. You know, it's magical.
Shell Rush is a game that you dig up shells and then you categorize them, you collect them.
You are tasked with cleaning up a beach that has been turned to an absolute wreck, and it is your job to pilot a mech in order to clean up all the shells while having fun along the way.
Patchwork Pizzeria is a cardboard-style pizza-making game, so user goes through different stations, make pizzas, and they run this pizzeria. In the game, they get to exercise and at the same time have fun with the game.
I wanted to make a game that you can do whatever you want in the space and still get points, you know?
While also being educational, trying to get these kids to move in ways that are easy for them, but also healthy for them.
So sickle cell is a genetic disorder that affects the development of red blood cells, specifically the hemoglobin. So unfortunately for these kiddos, they're born with it, and as they get older, it generally does become more impactful of their life, and they can have something what's called a crisis. So during crisis, the sickle cells have essentially started to break down, maybe they're starting to clump, maybe they are starting to cause obstruction. It generally causes significant pain for these patients.
When I do have these pain episodes, what I'll do is I'll have to manage it at home. I try to do my best to stay out of the hospital, but growing up I was frequently in and out of the hospital, unfortunately. And that could be weeks at a time. Just really all I remember is pain and sleep and pain medications and the doctors just trying to get the pain under control. And then finally I'll be able to go back home and recover from there.
Virtual reality has been an amazing adventure for me to step into. What I will say is, to me, the reason it is so powerful is how immersive it is. You are literally placed into a virtual world that is unlike our real world. And while the human body is capable of doing many things at the same time, it does breathing, balance, digestion, temperature control, all at the same time, the human mind can only do a few things at the same time. And so when you put someone in the virtual world, the mind has to decide, am I going to spend my time in this virtual world that's super fun and super interactive? Or am I going to stay in the IRL or real world or physical world where I might be hurting and this disease process might be giving me a bad day? And what we find is that many patients end up going into the virtual world and they're able to just do so much more there than in the physical world.
From my design, is very much meant to be played by patients who are pretty heavy in crisis. It's a distraction, it's something to immerse them, and it's something that you can do without having to move around all too much.
It is different from any other thing like animations or games on computers, because VR is something that actually allows you to be another immersive world within a small space.
I would say the biggest challenge we face is how to set our game apart, because there's a lot of VR games, and wondering how to make this specifically cater to the sickle cell patients is a difficult challenge. Making sure their voices are heard, that all the accessibility is accounted for, and that overall it's just fun. What's it like testing with little kids? It's a crazy experience because you get so focused on certain design elements and then they will completely not take any of that into consideration and focus on something little. Like, for example, you can just throw a water bottle in our game. Some kids spent minutes and minutes just chucking the water bottle over and over.
In my project, I'm very proud about how I was able to show sickle cell inside of the body, and hopefully that makes a big difference for kids being inside of something that they can relate to. I think that that's a big deal. Essentially, I wanted to help these kids with sickle cell feel noticed.
When I heard about virtual reality therapy for patients with sickle cell, I was super excited. Number one, because I never heard of virtual reality helping people with chronic illnesses in general. So that's just something I had never heard of. And I know it's going to be amazing when it gets out there to everyone. And number two, the fact that it's for people with sickle cell, this disease that some people have never even heard of. So I noticed that it is both educational and adventurous. So that made it very entertaining for me. I'm not sure if that's just because I'm a bit of a nerd, but I like that it was both educational and fun. I love the vibrant colors. I love the fact that you're actually in a blood vessel. That's so cool. You're actually stopping the sickle cell. So it made me feel very empowered and powerful as a person with sickle cell disease. Having control, any control that you possibly could, because this is something that is out of our control, is absolutely very important for us. And I think that if we can find other non-medicinal ways to control and cope with these sickle cell complications, that is great.
You know, we've done a variety of medical projects. The last one we did was with Moffitt Cancer Center, and we were so anxious after we were doing like an MRI patient education piece when they said, hey, can we gamify this a little bit? And we're like, oh, thank God, yes. But having this opportunity to collaborate with you all and to have something that affords our students a lot of creative freedom has been a real treat.
Try to design your interaction, have a good amount of interactions for exercising, but meanwhile considering the limitation that sickle cell patients has.
I would say we approach the accessibility by thinking that they might be in a different circumstance that we're playing the game in. They might have IVs in, they might be laying in a bed, they might be able to only use one hand or two hands. So we made the experience customized so that no matter how they're playing, they'll still have a fun experience.
So VR for sickle cell, I'm really hoping that, when kids come into the hospital with crisis, they are able to play this game and they want to play this game, and it's a repeated experience for them. And I'm hoping that one, it helps distract their pain, but two, also helps promote them to move and start to do their recovery process that is needed.
If the pain is just unbearable, it's hard to focus on anything other than the pain. But when it is at that 5 out of 10 level, then this is something that I think will definitely benefit others with sickle cell. Just having that mindset that you're going to get through it, trying to stay as positive as possible. If I'm in pain for days, which it doesn't get past a week anymore, but if it does get past that, then of course I would need to go to the hospital. Being that I'm on these different treatments that help me out, and then being that I have this mindset and a strong faith that God will get me through these complications, then I think that's how I've been able to, stay so strong, so positive minded, and being able to get through it.